I am delighted to be here with you today and joining today's Child Care Roundtable. The coronavirus has pulled back the curtain on a sector that has been long undervalued and underfunded, our child care system. And for too long, federal policy has treated child care as a nicety, an accessory, instead of a necessity. And we failed to invest in our teachers, their facilities, our students, and families. Moms and dads have always known that childcare is part of the infrastructure of our economic life. It is fundamental as our roads and bridges. But the lack of federal investment has forced the childcare sector, which is operated almost exclusively by women, to run on razor-thin margins and with an underpaid workforce. Moreover, the high cost and inaccessibility of care holds back millions of working moms from pursuing their dreams and achieving in their careers outside of the home. The coronavirus has pushed an already broken system to its breaking point, with women making up 1/3 of our essential workforce, 1 out of every 3 essential jobs, the forced closure of childcare centers, and with parents doubling as both professionals and caregivers, we're facing the perfect storm. Providers are on the brink of collapse. A survey from the National Association for the Education of Young Children has found that only 11% of our nation's child care providers will survive without government support. And an analysis conducted by the NWLC and CLASP shows that at least $9.6 billion, that's billion with a B, is needed each month to fully fund existing providers in the child care system. Meanwhile, families already struggling to pay their bills are wondering who's going to care for those children when the economy reopens. Reopening without childcare will push moms and women further back, and we're not going to stand for that. So I'm here today to say with all our incredible panelists, enough is enough. Childcare is too important to fail. And that's why I authored a letter in partnership with 84 of my House colleagues calling for a $100 billion investment in our child care system to aid in the relief and recovery and revitalization of the child care sector. It is vital that we invest $50 billion in the form of short-term stabilization funding to sustain the viability of providers that have been forced to close and to fund emergency care for the 6 million children of essential workers. Additionally, after we have successfully stabilized the child care sector, we must provide $50 billion in long-term recovery funding to support students, families, and providers. We cannot band-aid ourselves back to normal or to status quo. Neither was working. That's why I want to have this conversation together with my sisters in this fight. And I am so grateful to be here with you and to have your partnership in shaping this policy proposal. So let's get started. Our first question is going to go to Hannah Matthews. Hannah is Deputy Executive Director for the Policy at the Center for Law and Social Policy, otherwise affectionately known as CLASP. In this role, she provides leadership, strategic guidance, and support for the organization's policy and advocacy agenda. She is an expert on federal and state child care and early education policies and cross-sector policies that affect young children, including the children of immigrants. I'm grateful that she and her team have been working hard to calculate the cost of the pandemic for the child care sector. So our question today, Hannah, is what is the scope of the need in child care right now? And what might it cost to solve this issue?
Great, thank you. And I just want to start by saying, Congresswoman, thank you so much for your leadership on this issue. It's just been hugely critical, and I'm thrilled to be a part of this conversation with all of my sisters on this issue here. So the scale of the need, to be quite frank, it is pretty dire. You mentioned the precarious nature of the childcare system even before the pandemic, and that's because of the lack of public funding. We have a childcare system that is essentially funded by parents, and the government share of the contribution to childcare costs is actually pretty small. So what we have is a situation in which parents have lost jobs, they've lost earnings. We see the millions filing for unemployment claims. And as a result, they certainly can't pay their childcare fees. We have then hundreds of thousands of childcare programs that are at risk of closing permanently if they don't receive public funding to be able to keep them afloat. So to really understand kind of the scale of resources needed for this crisis, with the National Women's Law Center, and I'm thrilled to have Fatima on the call as well, we partnered with labor economist Aaron Sojourner, and really were able to come up with an analysis that showed that a $50 billion investment in childcare would actually meet the most pressing needs for childcare for a period of only about 5 months. So we looked at two areas of need. The first was childcare for essential workers. Everyone on the front lines of this public health crisis, whether it's our medical workers, our grocery store clerks, our transit workers, many of them are parents who need childcare to go to work. They can't work remotely like many of us on this call are doing. And that care right now has higher operational costs because we have to make sure that kids and the childcare workers in those settings are safe. So that was our first estimate, and it is about $6 billion a month to meet that those costs. The second area of need, this is the direct public funding to childcare providers who have lost revenue and who really are at risk of not being able to reopen even when it's safe to do so. If we don't sustain these childcare providers, we are at risk of dramatically reducing the available childcare that we have in this country when the public health crisis is over. And that's especially true for care in low-income communities and communities of color. These are communities that have been hit hardest by the public health crisis and the economic crisis because of historic and systemic inequities in our public policies. And the childcare in those communities is also at great risk of essentially disappearing. And so we do estimate that the cost of being able to maintain hundreds of thousands of childcare programs, 1.2 million childcare providers to keep them employed, that would be about $4 billion a month. So $50 billion right now, really vital to just keep our childcare system intact. But really the need then, as you say in your letter, for the longer term investment to really have a system that on the other side of this crisis is much stronger and able to support families and providers.
Great, thank you so much. Next, I am honored to introduce one of our second guests, and that is Fatima Goss Graves. Ms. Graves is the president and CEO of the National Women's Law Center, a National Law Journal author and advisor on the American Law Institute project on sexual and gender-based misconduct on campus. She has dedicated her life to advancing opportunities for women and girls and was even among the co-founders of Time's Up Legal Defense Fund. Amongst her many accolades, Fatima also serves as a legal expert contributor for major publications such as the New York Times, Wall Street Journal, Washington Post, and AP. Thank you so much for joining us today. And my question for you is, can you discuss how the lack of childcare has impacted members of our essential workforce, especially women, during this pandemic?
Well, thank you so much, Congresswoman, and for your leadership really spotlighting this issue and driving it through so deeply. We really think that this is a time for a collective reckoning about our values broadly, and caregiving and care work is really at the center of that conversation. I thought that Hannah really detailed importantly how we didn't start uninvesting, we didn't start an underinvestment in our child care system with the pandemic. This has been generations coming, but in the midst of this pandemic and a child care system that is on the brink of a collapse, care and care work could not be more critical. What we have learned is that women are at the center of the crisis in front of us for a range of reasons. They're at the center of the crisis as essential workers themselves. 1 in 3 working women are essential workers in frontline jobs. They're dominating in the healthcare sector, but they also dominate in sectors like grocery stores that have been frontline as cashiers. But they also dominate in the frontline jobs that also aren't always called frontline jobs, and that is as child care workers. 93% of child care workers are women. They're right now providing, as Hannah named, the child care to other essential workers, but they're doing so often without the sorts of resources that we've been talking about for essential workers. They're doing it often without things like premium pay, without paid leave and sick leave, without health care benefits at all, without the sort of cleaning and sanitation equipment, let alone other types of PPE and safety equipment that they need to provide safe care for the children of essential workers, and also to make sure that their own families are safe in this time. And at the same time, women are the majority of child care providers who have been forced to close or are on the brink of closing and having to lay off their educators, and for some permanently planning to shut their doors because they didn't have the revenue coming in to weather the crisis, and they have just been falling into a deeper and deeper hole in this period. And so as they're dominating these core jobs, we're deeply worried that the same group of women who are essential workers, who are working without a functioning child care system and really are struggling. And for the women who are at home and caring for their children while working, as a number of us are trying to do, and some of us not well, they're carrying the bulk of caregiving responsibilities for children while schools and child care centers are pretty much indefinitely closed and camps are largely closing. And as we look at what the future looks like, we have to be thinking about how do we have a system to return to? I've watched states announce plans to reopen without plans for childcare, and it is terrifying. If these businesses go under, they're not going to just be able to flip on a switch and be right back to where they were. And the women who are unable to return to work or return to their careers or train really for new careers as we recover from this crisis will be decimated if they can't find care. And that's why 2 additional things are important. One, we need to revamp exactly how we think about this issue. It is no longer acceptable, if we have learned anything, to think about this as an individual problem that individual families need to either work out well or work out poorly, and you're sort of swept to the wind. This is foundational for our economy, it's foundational for people to work, and it's foundational for gender equality in this country. But the other thing is the investment needs to come now, and it is a $50 billion investment, as Hannah named, just to stabilize the industry so that it survives and is there for all of us on the other side and as we move through this crisis. So thank you so much, Congresswoman, for your leadership again on this. This could not be a more important topic to have conversations about now.
Well, thank you, Fatima, and all the panelists for really bringing the need to reframe and redefine how we view childcare. And exactly as you said, we have to get rid of this paradigm that each family's on their own, trying to do, make their own choices, and really see this as the key part of our public education and our economy and workforce that it is. So thank you. Next, we're going to hear from Katie Ham. Katie is the Vice President of Early Childhood Policy at the Center for American Progress. Prior to joining CAP, Katie worked as a program examiner at the U.S. Office of Management and Budget on federal child care and early education programs, focusing on developing budget proposals to strengthen the quality and access to early childhood programs. Ms. Ham, thank you for being with us today. And my question for you is, many parents are surprised when they go to find childcare that it can be difficult to find a program without a long waiting list. How might childcare supply be impacted over the long term when we already had this problem going into this pandemic?
Yes, thank you so much, Congresswoman. As a parent, I am so grateful that you are championing this issue in Congress for so many of us. I'm really excited to be here today. As you said, it can be really hard to find childcare, and it was before the pandemic. We know that pre-pandemic, about half of Americans lived in a childcare desert, where there was just not enough licensed care to support the demand in the community. So many parents are struggling right now. They either have children at home from school and childcare, or they're going in to fulfill essential jobs and trying to make childcare arrangements in the absence of their programs being open. We know that school is eventually going to be open. We don't know when that will be, but we know that because teachers are public employees and they operate in buildings that are publicly owned, that they're going to be able to open their doors. And the same cannot be said about childcare. So when we get to the other end of this, as both Fatima and Hannah alluded to, we might find that there are childcare providers that just cannot open. We know that childcare providers operate on extremely thin margins. I think there's a misconception out there that because childcare is expensive, that there's a lot of profit to be gained. And the truth is that most childcare providers are barely covering their operating expenses with what they take in. So when they have to go weeks or months without bringing in revenue, or with reduced revenue because they're implementing social distancing, there's a real likelihood that these small businesses that are mostly women-owned will fold. At the Center for American Progress, we have estimated that we could lose 4.5 million childcare slots. That is half the licensed childcare capacity in the US. In Massachusetts alone, we could lose over 50,000 childcare slots. That also has a huge impact on the workforce. These are workers who are underpaid for the important and essential work they do, earning $11 on average. They're disproportionately filled by women of color. And so there's a real need, as both Hannah and Fatima have said, to stabilize childcare and protect these really important jobs that we need so that people can go to work, especially working mothers.
Yeah, great. Thank you so much. Thank you for the work that you've been doing and for being with us today. Next, I would like to introduce Rianne Evans-Alvett. Rianne is the Chief Executive Officer of the National Association for the Education of Young Children, the largest national professional association for early childhood educators. Since 2013, Rianne has transformed the organization to better serve members, exert strong policy and advocacy leadership, and streamline the early childhood program accreditation system to define program quality. Ms. Alvin is also a wife and mom of 3. I am as well. One just went by, as you might have seen. Throughout this pandemic, NAEYC has been hard at work providing support and checking in with educators and providers throughout the country. Thank you for your work. Thank you for being with us today. And my question for you is, one thing the pandemic has highlighted is just how essential the childcare workforce is. How can we support this vital workforce during this pandemic time and beyond?
Thank you, Representative Clark. And I often have visitors in my office, so I feel that. And thank you for your leadership. We would not be where we are without it. So we're extraordinarily grateful. And as you mentioned in your opening remarks, there are 2 million early childhood educators in this country, most of whom are women. Half of them are in family childcare homes, the other half in center-based programs. And the science of early learning shows us that we can't deliver on high quality without a workforce that is invested in, that is compensated, commensurate with experience and with education. And we also know that the workforce was teetering, as Katie said, before the pandemic. And so this is both an opportunity to invest now. We are pleased to see so many governors as they create their policies around the Child Care Development Block Grant, that they are for those early childhood educators who are working now and serving essential personnel. It's the bonus pay that governors have created in many systems so that they're acknowledged for the work that they're doing this time, the rigor of childcare providers to protect their employees and increase make sure they're following CDC guidelines and social distance policies, that they're doing temperature checks, that they're creating an environment where for those who are going to work, have an opportunity to feel safe and be healthy. For those, we know a large percentage of the workforce is either furloughed or currently unemployed. And so making sure that early childhood educators have access to unemployment insurance benefits. Many employers who have furloughed their employees are still paying for their health, their medical and dental benefits, which is really important to stabilize the economics of the current situation. So acknowledging what it costs either to be unemployed right now or what it costs to be working in these extraordinary times. We do think this is an opportunity for governors to continue policies that have been implemented during this time. We have got to right size the marketplace so that on an ongoing basis, early childhood educators are paid in commensurate with their experience, and that they do have access to medical and dental benefits and retirement benefits. We know from many surveys that we've done historically that early childhood educators want this to be a career. They want to stay in the field, but we create an economic situation that is often prohibitive for them to not just be passing through, and we can fix that. As Katie said, early childhood educators are making on average $10.70 an hour. 46% of them are eligible for public assistance. And so as we think about policies moving forward, we've made progress actually in a lot of the CCDBG work that we've done in the last 2 months. And in the last 2 years, since Congress has made such significant additional investments in the Child Care Development Block Grant. So states paying for the full cost of care will help early childhood educators earn commensurate wages, making sure that that progress stays beyond this emergency pandemic, I think is really important, because we've got to make the science is clear. The same hard science that supports the value of nurses supports the value of early childhood educators. I can't imagine where we'd be right now if nurses were being paid $10.70 an hour. And we have got to connect the dots between what the science is telling us and what our policies are. And the investments we make in early childhood educators will pay great dividends down the road, both for individual children and for our country.
Oh, well said. And it is just an area that has been so underfunded for so long. And we have the opportunity to rewrite the future in a way that's going to support this critical workforce and our children and families. So thank you so much. And Last but certainly not least, I'd like to introduce the Executive Director of the First 5 Years Fund, Sarah Rittling. At FFYF, Sarah focuses on the needs of children living in poverty who would benefit most from access to high quality early childhood educational opportunities. Her previous experience on Capitol Hill has helped bridge the gap between policy and education. On Capitol Hill, she worked under several senators advancing educational efforts such as the reauthorization of the National School Lunch and Child Nutrition Act and the Individuals with Disabilities Education Act. Ms. Rittling has also been a great partner to the bipartisan Congressional Pre-K Caucus. We thank you for that, and thank you for joining us today. So my question for you, Sarah, is most parents need childcare so that they can go to work. What are the economic consequences if we don't support childcare providers during this pandemic?
Thank you, Congresswoman, and thank you again for your leadership, as everyone has said. I think what we're seeing and what you're living every day in Congress is a lot of competing interests because there's such desperate need across the country in so many different sectors, whether it's our healthcare workers, other industries that are failing. And I think what's crystal clear from everything you've heard today, and certainly everything we knew before, it's that the availability of childcare is undercutting and necessary if all of those things are going to work going forward. Prior to this pandemic and to all of us being at home, the U.S. Chamber of Commerce Foundation did some work in a couple of states where they were able to identify that in just Mississippi, Pennsylvania, Iowa, and Idaho, there's a $5.5 billion loss in the economy as a result of childcare difficulties that families face. So you can only imagine if all of the things that we've heard today about the supply, as Katie mentioned, certainly about the need of essential workers and providers that are providing critical services right now, the Fatima and Hannah raised, excuse me. And then from what Rian said about just the providers who are not able to stay afloat, can you imagine how that's going to be exacerbated when we return back to work in phases a little bit, or eventually, hopefully, when we're all back? So the cross-cutting nature of this, certainly, I mean, it's been the economy side writ large, but we're all many mothers on the call right now and parents who are living their reality. I think you mentioned it when you said we now, it is a whole new vision on the need for childcare, and that this is a public issue that again is really cross-cutting. So thank you again. It is an economic issue. It's a women's issue. It's a parent issue. It's all of our issues. So I'm really excited to be working with all of you sisters and trying to get something done.
Oh, well, thank you, Sarah, and thank you for the work you've been doing. We truly appreciate it. We have time to do a few more questions that I'll sort of open up to the group. We know that families of color are among the hardest hit by the COVID crisis and before the pandemic. Many children of color and children with low incomes lacked access to quality, affordable childcare. How does this proposal advance a more equitable childcare system? Fatima? Or
oh, I'm happy to jump in.
I saw
the
button go off. That's what. Or Hannah, either one.
Well, why don't
Go for it, and then I'll jump in. We can both go.
Okay, great. I mean, well, so one of the things that I just want to raise is in part because I gave both the gender statistics, but I didn't give the race and gender statistics together. And I just wanted to name that, you know, when we think about having a holistic child care system, it is for sure one that thinks about both the workers, the parents who need care and the providers as well. And the worker population is heavily women, disproportionately Black and brown women. And it is the same families that are sometimes providing care that are also needing care. And so again, if we are able to move to thinking about care needs as foundational and ones that all of us have a shared stake in, then we can have solutions that allow for our caregivers to be paid equitably and to be able to work with safety, for our parents to be able to have safe places that they can actually afford and access so that they know that they can consistently work as our economy begins to reopen and as people are searching and looking for care, and for our children to be able to have the quality they need to thrive over the long haul.
Great. Hannah?
Yeah, so the only pieces, I mean, I would add to that is that, you know, we're talking about the childcare sector as a whole, and it is absolutely at risk, but we also know that the impacts of this crisis will not be felt universally, and they will be felt in disproportionate ways, just as we're seeing data coming out on the workers who have lost their jobs, disproportionately Black workers, disproportionately Latinx workers. So those, and we have had these inequities in our childcare system long before this pandemic. The supply of childcare in low-income communities, the supply of childcare communities of color has been lacking for many, many decades. And so when we think about the piece of your proposal, Congresswoman, to really think about not just the immediate needs, but shoring up childcare for the long term, that public funding can play a critical role in really turning around some of these inequities that have been in our childcare system forever. Making sure that parents that need the most help paying for childcare are going to be able to afford high quality childcare on the other end of this crisis. Making sure, as Fatima said, that the workers, primarily women of color, are paid what they deserve, and that childcare workers are, you know, earning a living wage with benefits and all of that. So this is not just about kind of keeping the current system in place. It's about how do we think about a childcare system on the other end that looks very, very different and really meets the needs of all families, because we don't have a childcare system that has been able to do that.
Great, thank you. You know, there's been a lot of talk about the federal government's role in supporting help for families during this crisis, but we know that states are significant partners in our nation's efforts to increase access to high quality childcare. How, with state budgets being further stretched, and we're certainly hoping and pushing to get them more relief, but how can states and federal government work together to secure a strong childcare foundation now and for the future?
I can jump in, Representative Clark. I think the investment you're proposing is essential. And as I watch states at different stages in reopening efforts, I'm concerned that there will be a perception that now that they're starting to reopen, we've got this. And it's so important to address the underlying economics of this situation. Reopening states and thinking about how and when childcare opens shifts the burden from the government making decisions about this across the board to individual families and communities making decisions, individual providers. And they're in really tough situations in making those decisions about, do I lose my job? Do I go back to work? And it is absolutely, the investment that you're proposing is more critical now in light of reopening than it even was with everything shut down. And so when I think about the billions of dollars that you're proposing, and that going to cover fixed costs for providers while they're stabilizing and reopening? Because even as they reopen, enrollment will be substantially down. Social distancing policies will require lower group sizes. And so where the economics of the field barely worked before this, it will be upside down as states reopen. And so the most important thing Congress can do is make this investment in our field, and not just to get struggling programs to survive, but to get them to thrive and really acknowledge that this industry is the backbone to the rest of the economy, and to do so in a way that marries the role of childcare, keeping kids safe while their parents work, and capitalizing on the more than 2 decades of neuroscience that we have now. That it's got to be a high quality experience to get the return on investment that we talk about. And so with the federal government, governors by and large have done a terrific job at reimagining what this should look like during the crisis, and we can't go back. And so Congress really is supporting financially those efforts for governors to change eligibility restrictions so that more families have eligibility to support for public funding. Again, to continue to provide the incentive pay that we've seen for early childhood educators who are working right now, and long-term to fully pay the cost of quality, and do so in a way that it's affordable for middle-income families too.
Yeah, we know the research shows us not only is this great for our youngest learners and their brains, but for every dollar we invest, we get a minimum of 7 back. And it's just long overdue. I have been asked to remind the reporters on the call to please use the hand raise function if you want to ask a question. And my next question, as we look at Mother's Day coming up on Sunday, we know that childcare is so important to families across the board, but why is it so important to working moms?
Yeah, I can jump in and then welcome others' thoughts as well. So we know that, during the pandemic, mothers are taking on a lot more caregiving at home. That's been true for decades. We also know that from research before the pandemic that difficulty finding childcare really impacts mothers' employment status. So when we did some research to look at what happens when families have difficulty finding childcare, when they get put on a waiting list or they don't find a program that meets their needs, whether that's evenings and weekends or culturally appropriate care, we find a 12 percentage point increase or decrease in the likelihood that mom will work, and no measurable impact on the likelihood that dad will work. So one of the fears that I have is that, as Rhian was saying, as states start to try to reopen, if childcare is not available or not safe, or if providers are not able to stay afloat during the pandemic, it's going to have a big impact, especially on maternal labor force participation going forward. And I think that's especially true for families of color that are often kind of facing this crunch where they're more likely to have all parents in the workforce, but also have fewer resources because of structural racism to pay for that childcare that they need.
Great, thank you. And one of the proposals in the bill for a long-term investment is an increase in mandatory funding for CCDF. And in what ways would that mandatory funding being increased substantially, how would that be impactful for states, providers, and caregivers?
So I can start. So mandatory funding means that we provide funding based on need, right? So the same way that someone may be eligible for nutrition assistance, they can get it because they qualify for a program. Childcare doesn't work that way. Childcare is subject to an annual appropriations process, which means we have a set amount of money, and that's how much states can deal with. So all of these childcare policies that we talk about that frankly have contributed to some real challenges in terms of cost, in terms of pay, in terms of quality, are because governors are essentially dealing with making these decisions in the context of scarcity. When there's not enough funding to be able to provide services for whoever comes forward and needs it, then you're making choices about how much you're paying a provider that trades off against how many kids you can serve in your program and the quality investment. So what we really need, as we're all talking about getting to a childcare system that looks and operates very differently from the one today, is a system where those decisions aren't made in scarcity, where we have funding that can meet the needs of families who need affordable childcare, who need help paying for childcare, and that they're getting that payment at a substantial level that we can pay providers, again, what it takes to actually care for children and have those investments in our system. So that would be a fundamentally different system than we have now. And it's really important that we start making steps to get there.
Yeah, I think we want to be aware that sometimes it's difficult to spend this money quickly. And that I think we also have to be looking, and I'll be coming back to all of you for your ideas on what flexibility we need to build in to make sure that states are, able to get this money out to providers and that they are able to make the improvements. One of the things this proposal calls for is an investment in infrastructure, which is often just never thought of when it comes to childcare. And yet we know there are great needs around that. So we also know that can take time, but maybe if one of you just want to talk a little bit about those infrastructure needs and how we just don't think about that with childcare like we do with other areas of public transit or other areas of important infrastructure.
Yeah, and my goodness, Congressman, you could answer this better than any of us, given the work you've done on facilities to date. But I think, when you think about childcare, the physical space is equally as important as the care that they're receiving from the loving, caring adults in the center or the home that they're in. And prior to COVID, there was a great need to be able to update and maintain and keep these spaces up to a standard that was going to make them healthy, safe, and developmentally appropriate. And so now, Rian started to touch on this a little bit, thinking about the needs of providers and what they're going to need to do, whether it's in a home or it's in a center or some new imagined place, whether it's additional toilets or sinks or entry places where you can take temperatures and all of the new realities that are going to be facing us in other aspects are only more important when we're thinking about the care of our children and where we're comfortable with them going, as Katie touched on, with the choices that parents are going to make. And so the infrastructure and facilities piece and the physical space, in addition to just the quote unquote infrastructure that childcare provides, back to my initial statement earlier, I think are all really big pieces of this going forward.
Great.
If I could just add if I could just add one quick thing to that point, because I think we usually think of infrastructure as only physical space, and the need is going to be so deep and great for any business and any organization that is reopening to be able to comply with new rules that are designed around safety. But I also think it's an opportunity for us to recognize what Sarah said has been true all along, is that just investing in children and investing in childcare itself is infrastructure. And because childcare prepares children for the future, because childcare offers services that are really essential for people to work in the same way that transit ends up being essential for people to work, and it provides benefits for families' entire wellness. And I think part of the decades of disinvestment has been around not recognizing it as the infrastructure that it is, and the opportunity around the pandemic understanding that we now have is to shift that entirely.
Yeah. Well, that is fantastic. That concludes my specific questions, but Catherine Alexander says we have great questions in the queue. So Catherine, if you could share those with us.
Yes, thank you so much. And just a reminder, if you are a reporter who'd like to ask a question, please use the raise your hand function. But I'm going to pose some questions that have been submitted from attendees listening. One of which is talking about family daycare and how does family daycare or daycare in the home fold into government subsidies and this expanded proposal by you, Congresswoman Clark, and to everybody.
Well, family daycare would certainly be eligible for many, if not all of what we're talking about in this proposal. And I think it's important to remember, I personally, when my children were in childcare, have used every type of childcare I think there is. Big center, family childcare, you know, nonprofit, for-profit, we covered it all. But family childcare really does serve a very special need for families, and that it is often a place which is close to home, which can offer some flexibility around hours, and can also, we find, can serve families that are part of a linguistic minority or are looking for particular cultural experience for their children with foods that are served at home, etc. So we want to make sure that these family childcare providers are included in this because they are a vital part of this system. And many of them do accept subsidies, but we are also looking to extend the support that we're going to give this industry beyond just providers that take public subsidies and some of the private providers too, because they are also part of this key infrastructure and support for our economy. So I don't know if anyone else wants to add in something to that.
I would just add that I know in a lot of the work that is happening with CCBG right now, and I know in what you're proposing, family childcare providers are included and considered, but there's this fundamental issue, whether it's family childcare or center-based care, back to, we have said, okay, you know, it may cost $10 to do this, but we'll go ahead and do this for $1. And we're not going to we're going to try to do it on the cheap and hope we have the same kind of outcomes for children or not. And family childcare providers bear the brunt of that oftentimes because there's a sense that it's cheaper to do family-based childcare, and it's just not the case. And so we have got to reconcile as a country this idea that, is this a private good or a public good? Because the fact of the matter is there's a great economic case to say it's both a private good and a public good. And if we acknowledge that and actually pay what it costs to provide care, the things you're talking about around infrastructure, around what early childhood educators should earn, starts to reconcile itself. And I think it was Hannah who mentioned the scarcity issue. Because there's always been scarcity, we're making Sophie's choice. Do you serve more children at a lower quality, or do you actually pay for the cost of care? And I think I would say to all of us, like, we can't be hand-wringing about naming what it costs to provide high quality childcare, because we've got really good data that shows this is good for our entire country. And so, and I think family childcare is as much a part of this sector as Head Start is, as any school-based childcare is, as a center-based or a faith-based childcare. And the value it brings is no different than any other setting in childcare.
Fabulous. And we've got a question from Kathleen. Great. We've got a question from Kathleen McInerney. Kathleen, you should be unmuted.
Hi, can you hear me?
Yes, we can.
We can.
Thank you very much. I'm with WBUR. I'm just wondering, Congresswoman, if you could explain, there was funding in the CARES Act, primarily through PPP, for daycare providers. Why is this bill necessary? Why is the funding that has already been put out not enough?
with the entire PPP program that it is going to be insufficient, and we've already had to go back and double that program. But we also find that with childcare providers, these are often very, very small businesses. They don't have the established relationships with lenders, and we are hoping that we can, by focusing on this industry, we can help them get the help they need, because it is going to be so crucial to reopening our economy. I was very pleased to see the Boston Chamber of Commerce yesterday come out and say one of the great barriers to reopening is going to be childcare. Here in Massachusetts, childcare has been closed through the end of June on the same schedule as schools. But if we're starting to reopen, if we're going to start to think about reopening, we have to make these investments in childcare. And we're seeing states across the country begin to reopen. And if they are going to do that, we have to make sure that that care is going to be there. And not just for the short term, but for making the changes that we know this entire ecosystem of early education and care needs. And so now is the time to make these investments, to make sure that these childcare providers can access funding, that they can stand their programs up, that they can make some changes to safely begin to have children back in care. And we know that's going to be a process. A lot of parents are really questioning about whether childcare is something they can safely return to. And we need to help these providers make that case, so parents aren't forced with yet another terrible decision tree about, I need to go back to work because there are bills that need to be paid, and I have to also, I want to be sure that I am sending my child somewhere where my child will be safe, and I also won't be picking up the coronavirus from my child at the end of the day. So we have a lot of work to do to treat childcare providers as the essential workers that they are, both to our future and in response to this pandemic.
Fabulous. I want to thank everyone for tuning in to this afternoon's roundtable. I also want to let you know that this is a jumping off point. The Congresswoman will be hosting a series of childcare roundtables with various experts and stakeholders from the provider community to our workforce and families. Thank you so much for joining us today and for our panelists. And we are now bringing the roundtable to a close.
Thank you so much.
Thank you.